I don't know what state you guys are from, but over here in a blue state, it's like a sanctuary state. Going to the ER or the emergency room is a complete nightmare. When you're a tax-paying American citizen and you got to go to the ER, the place is already crawling with a bunch of illegals and their families of double digits already in the room. There's like 100 people in there, and you go in by yourself. Oh man, be prepared to wait like 12 hours. You walk to the front desk and you see a bilingual chick, and she's the same color of most of the people in the same room. You know, you're waiting in line, they're laughing it up with the family before them. Oh, blah, 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 la, la, la. And then they get to you, and she gives you this dirty look because she's like them, and you're the outsider. You're the minority at that point. She hates your guts secretly. She doesn't do anything special for you. You gotta go way to the back while this family before you gets special treatment. Their kids are running around the place. They're double digits. Their whole family's there. They're their family of 10. The kids are running around the joint. Hey, Mio, get back here. Mio! You know, that kind of crap right there. And you're in pain. You're at the ER. Lord knows what these people are here for. Maybe they're here for a headache. They got a fingernail broken. They got watery eyes. Maybe like their pregnancy complications or something like that with their middle-aged school daughter or something like that. And that's why they're at the emergency room. And it's going to cost, you know, the hospital $200,000 for this visit, whatever they're there for. And you're the one that's got to pay for it. They're on illegal immigrant health care. But yeah, they get special treatment. Oh yeah, come on over there. And you got to sit back in the line, and you're paying for it. You're paying for everybody in the room. You being the American citizen. Cell phones are going off all over the place. People are talking on their phone in the emergency room. Middle school students, you know, of those types of families are on their $2,000 iPhone, you know, playing whatever game that's costing them money and stuff like that. Yet they can't afford health insurance. You're sitting there in pain, waiting for 12 hours in that emergency room. You try to make a call in that noisy ER on your LG phone because you can't afford an Apple or a Samsung because you pay way too much taxes. That's the joy of living in blue states, in these sanctuary cities, these sanctuary states where the illegals get everything for free, including health care. They're on your health care. You pay for it in taxes, they rip it off you, and you gotta pay for all these families that run amok in the ER. Kids running around, get back here, mijo! Blah, 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 blah. Apple iPhones, the middle schools, students, the kids have these expensive cell phones, and you're stuck with an LG paying their bill with the taxes, and you go to the back of the line because the receptionist, the bilingual receptionist, that's why she got the job. She hates your guts because you're the American in there. You're the minority. And oh my God, how it sucks living in the blue state. And that's the whole point of this government shutdown. We're putting an end to all this free healthcare for the illegals.
We should not have to pay for this trash. So that's why, stand your ground. Keep the government shutdown going. Do not give in to the liberals.